But I've just said this isn't a vaccine. It's something different. What exactly is it?
Oh, it's a treatment. So basically, we're really lucky that there's been the groundwork laid for us already, in that people have looked in the test tube in the past, they've looked in experimental animals, and there's some data from China, although it's a bit murky because it was really undertaken, in a situation of extremis, meaning, their hospitals were overrun. But there's certainly positive signals that either this HIV drug or this anti-malaria drug actually work really well against COVID-19. And so a group of infectious diseases doctors like myself have got together across Australia, and we've all committed to doing the same protocol. So we're going to compare the HIV drug, the malaria drug, and both put in together to see what is the best treatment approach for our patients.
So you describe it as a treatment. Is that the same thing as saying it's a cure?
Absolutely. We know that in the test tube and in the patients that have been studied so far, they're able to recover and have no more evidence of virus in their system.
So, David, is it something like, say, Tamiflu, whereas someone in your family has flu and then the others take Tamiflu, it reduces the severity of what they get if they get it? Is that a way of explaining it?
That's right. I mean, basically, we know that these drugs actually do stop the virus in their tracks, and therefore we're able to reduce the amount of virus, and then the person's immune system, of course, comes on board and that they can recover.
So, David, obviously, public anxiety is creeping up day by day. How excited should people be about this development?
Well, I think it really does give us some hope. It's a very gloomy time at the moment, economically and socially. I think that's just a really exciting development, and I'm proud to be sort of part of this team. And it is a huge team, so this is really something that could be a world first.
And it's brilliant, the collaboration involved too, because obviously collaboration is the key. But the only thing standing between you guys and a possible treatment is $750,000. You need the money to be able to investigate it. Are you hoping the government will stump up, or what are you asking for?
So we've had brilliant support from the community. Obviously, we need more support, particularly if we are going to extend the reach of this study even to regional centres. Originally, we had planned it was just going to be big hospitals in Melbourne and Sydney and Brisbane, but now we've got people calling out from all sorts of smaller hospitals wanting to be able to offer their patients this particular chance.
So, Professor, if you prove this to be successful in humans, how quickly could you roll this out?
We're thinking it's obviously going to depend on the number of patients who get infected. And unfortunately, the predictions are that that's going to be pretty high. But it could be as short as 3 months that we have an answer from this trial.
All right, Professor, we better let you get back to your work. All the best to you and your colleagues with it. Thank you so much for speaking to us.
Thank you.
Surely that's the easiest check Scott Morrison can write.
Oh, surely.
You would think, you would hope.